Welcome to the Health Workforce Technical Assistance Center's webinar series. My name is David Armstrong, and today's webinar is entitled Comparing National Scopes of Practice for Behavioral Health Providers. Our presenter is Cory Page from the Behavioral Health Workforce Research Center at the University of Michigan's School of Public Health. After today's presentation, you may ask questions using the chat panel on the right of your screen. Make sure you send your questions to all panelists so that they have an opportunity to be heard. Now, at this point in time, I'm going to go ahead and turn this event over to Cory. Cory?
Thank you, David. Greetings, everyone. Good afternoon. As David said, my name is Cory Page. I'm a project coordinator here at the Behavioral Health Workforce Research Center. We are joint funded through a grant to the Health Resources and Services Administration, HRSA, and the Substance Abuse and Mental Health Services Administration, SAMHSA. We are one of HRSA's 7 health workforce research centers. I want to start with a little bit of background on our project before we actually go into the tool, but rest assured I'll be taking you directly into the tool itself and showing you how it works and all its functionality. But in order to understand where the data came from, I want to take a quick little dive into the history of the project. In summer of 2016, we were tasked with collecting the scopes of practice and credential requirements for 10 behavioral health occupations across all 50 states and DC. That was a lot of data to gather. For clarity, a scope of practice is a legal authorization a state gives an occupation to provide certain services. So this is where a state would authorize, say, physicians to order diagnostic tests, to provide diagnoses, to prescribe medications, to engage in surgery, medical assessments, things like that. The thing is that if professionals attempt to provide services outside of their legally defined scope of practice, they can be subject to fines, penalties, they can lose their license, they can face criminal charges. These scopes of practice are not only for deciding how the workforce behaves within a specific state, but it's also meant to protect consumers as well as professionals alike. So to keep our data gatherable, to make this project have a scope that we could actually finish, we limit ourselves to 1 credential per occupation per state. This means that, say, if there were multiple credentials available for a single occupation in a state, like, say, in, I don't know, California, there were multiple versions of, like, mental health counselors, where one was a supervisor and one was an associate and one was just independent practice. We would only take 1 of those credentials. The occupations that we selected were from SAMHSA's list of the behavioral health workforce and included psychiatrists, advanced practice registered nurses, psychologists, mental health counselors, marriage and family therapists, clinical social workers, addiction counselors, peer recovery support specialists, prevention specialists, and psychiatric aides. For licensed occupations, what we did is we went to the regulation boards, the state regulation boards for that specific profession. Sometimes it was for multiple professions within one board, like, say, a state board of counseling, which would contain mental health counselors, marriage and family therapists, clinical social workers, and the like. Sometimes there were separate boards for each specific occupation, and we'd have to go to each of them. But what we gathered from these boards were their statutes and administrative codes, so the laws and the rules by which they operate. That's where we were able to get scope of practice information and the credential requirements, which you needed to do in order to get the license. Now, for certified occupations, we weren't able always to find those statutes and codes. Sometimes we did. Occasionally, certifications were offered by, say, the Department of Health within a state, in which case we did have laws and rules that we could access. But more often what we saw was there were state certification boards, and these are more independent organizations that are approved by the government to offer certifications, but are not directly administered by the government. So we would go to those certification boards and look up whatever training materials they offer, whatever guides they offered, to find what these professionals were allowed to do and what it took to become this professional. Psychiatric aides were a unique class. Unfortunately, they don't have many certifications or licenses nationwide. I think we only found 5 cases of a license for a psychiatric aide. I think we found 1 or 2 cases of certification, and the rest we just couldn't find anywhere. Ultimately, what we ended up doing was going into Department of Labor occupation codes in order to find something that was akin to a psychiatric aide, and we borrowed information from that, but that information is typically very spotty. So psychiatric aides are definitely our weakest category that we collected on. That was summer of 2016. We ended up with over 550 rows of data for all kinds of variables, which we'll be going over once we actually move into the tool. In 2017, we expanded the data. So instead of just having one credential per occupation per state, we expanded the mental health counselor's occupation to include all of their credentials across the country. In 2018, we did another expansion where we expanded to collect all of the AC credentials, the addiction counselor credentials, as well as the peer recovery support credentials. We also added community health workers as an 11th occupation within our database. So we'll be transitioning into the tool itself now. All of that history was to tell you that this tool currently only covers our summer of 2016 data, so the one credential per occupation per state. We are in communications with our programmers of our website to expand this tool and make it have all of the data that we currently have, but that's going to take some doing. It is on the horizon, it is coming up, but for right now, the only data we'll be able to access is from the summer of 2016. About the tool itself, the program that we used to create this data visualization was called Tableau. Tableau was a useful program for what we needed, not only because it was relatively simple to use, but because it spoke with all the programs that we do use. Not only does it plug into our website helpfully and easily, but it also connects with Google Sheets. So if I were to change something on our database, it would automatically be updated in Tableau. Furthermore, Tableau is hosted on a separate server from our website, meaning that no matter how many visitors we have coming and providing queries to our tool, it's not going to bog down our website. It's going to hit a separate server, which is kind of technological and a little bit specific, but we really appreciated that. Furthermore, Tableau has this useful function where every time that we change the database, it will do a save state. It will take a screenshot of what the data was before we changed it. What this is going to allow us to do going forward is it's going to create a living record of when policies were changed in the state as to what a profession could do or what they needed to do in order to get licensed. And this will allow us useful research opportunities going forward. If we have this longitudinal record of how these occupations are changing based on their statutes and administrative codes, we could learn to associate that. We could run statistical analysis based on like workforce numbers in the state, for instance, to see if these policies had positive or negative effects on the size of the workforce. This will help us create evidence-based policy recommendations going forward for how to bolster the behavioral health workforce. So now let's get to the tool. I mean, you have all the background now. It's time to get to the tool. So this is our home website. It is undergoing a little bit of redesign currently, but it will remain the same in terms of its navigation. So you come to our home website at behavioralhealthworkforce.org. You go over here to Data and press Data Visualizations. This takes you to our tool. First thing I wanted to point out is that we do have a user guide ready to go. It is a downloadable PDF. I'll click that and show you what that looks like. It's going to go over pretty much everything I go over in this presentation, the project overview, which is everything I just told you, the data dictionary, which is going to tell you about every variable that we cover in our database, how it was coded, what it means. Technical consideration refers to a little bit more of the nitty-gritty about what browser or what type of device you should be using to get the best performance out of our visualization. It talks about both of the visualizations. This is a two-part tool. We'll be going over both of them today. And then it gives you a preview of coming attractions and a way to contact us. I'm going to scroll down here. We do our best to take screenshots throughout to really guide people in what they can look at. So if at any point you need to follow along, you want to learn something about it yourself, you can pull this up, and it will give you all the instructions that you need. So here are the two tabs that we switch between our two sides of this tool. The first is the characteristics tool. As you'll see, we start with an interactive map, and below that map is a table that is generated based on what is selected on the map. So currently, all 50 states and DC are selected in our map. So output below the map are the 10 behavioral health occupation credentials for every state. Now, this tool is mostly meant for exploring and summarizing a whole state's worth of data. The variables that are output cannot be changed, but they're a good summary of what that occupation looks like. So degree type refers to whether or not anything over a high school diploma is required. So if this is marked yes, it means at least some college or a special degree is required. If no, then a high school diploma is all that's required to get that credential. We have the occupation name, which is just the overall category, and the specific license name, which can change. So for instance, mental health counselor is the occupation in general, but in Alabama, it's called a licensed professional counselor. Education hours can be contact hours or semester credit hours. Practice hours are postgraduate practice hours required for licensure. Supervision hours are direct supervision hours required for licensure. Completion time is in months, the minimum amount of months a person has to practice before they can get the credential. Reciprocity and endorsement are two ways to gain a license when coming from a different state. Reciprocity refers to having a license in a different state, coming into a new state, and then receiving that state's license off the strength of already been licensed. Whereas endorsement has to do with coming into a new state with experience in education earned in a different state and having that experience in education honored towards a new license in the new state. Continuing education hours are the education requirements necessary before renewing one's license. We also have the scope of practice variables of assessments, whether or not someone can make a behavioral health assessment of a patient. Diagnosis, whether they're allowed to provide a legal behavioral health diagnosis. Psychotherapy is just can they render counseling or therapy services. Crisis intervention, can they intervene in a crisis? And this guy hidden back here is telehealth. So maybe you don't want all 50 states worth of data in DC. Maybe you just want Michigan. Who wouldn't, right? With a simple left click, you can select whatever state you want, and now only that state is going to output below. So we only have Michigan. But what good is that if we don't have something to compare it to? If you can hold control and click a different state like Ohio, you can have two states outputting, Michigan and Ohio. If you want to go back to having everything selected again, you can either press reset filters or click off into the ocean. So just select the entire map again. If you want to select multiple things at once, aside from just left clicking, you can go over to this tool here and select this feature, which will allow you to left click and drag, and anything you select in that area will be selected below. You can zoom in or out because some of these states are kind of small and difficult to pick. You can do that with your mouse wheel or by pressing the plus and minus keys. And if you were to move way too far out of the way and you can't find the country anymore, this will happen. Just press the home key and you go right back to center. The really useful thing about this tool that we really wanted to be able to have for our visitors is the export function. So let's say you make a selection. Let's just try and grab as much of the Midwest here as we can. I got West Virginia in there too. Can I? Yeah. Controlling and left clicking will also allow you to deselect states. So I've grabbed the Midwest here, and I can see below that the Midwest is now being summarized. Neat. I want to take all that data with me. By pressing the export to .csv, you will actually create the CSV file with only your selected data. If you have the entire country selected, you'll get 50 states and DC's basic summaries for these variables of all 10 behavioral health occupations per state. It opens in Excel natively, but you can also open it up in SPSS or anything else you'd like. As you can see, the data is a little messy, but sorting it is not going to be a very difficult issue. This is just a problem native with Tableau. It is a useful program, but getting things to output or export pretty isn't always the best bet. But everything is lined up as it needs to be. And as you can see over here in the state ID column, we only have the states in the Midwest that we selected. Exit out of that. But let's say you want a different variable. Maybe these variables are too much, maybe they're too little, and you don't care for all 10 occupations, you're only interested in addiction counselors, or you're only interested in peer support specialists. That's where our second tool is useful. Go back up to the top here. What's the comparison tool? Now the comparison tool isn't as pretty, I'm going to admit that. But what it lacks in beauty, it makes up in functionality. We have three basic boxes that you're going to be selecting: the who, the where, and the what. Who you want to look at is the occupations. Right now, all 10 behavioral health occupations are selected. Where refers to the states. Currently, all 50 states and DC are selected. And what refers to which variables specifically you want to look at. You can have 8 at any one given time. We did our best to make this plain language, so instead of the technical variable name that we selected, we did try to do a plain language description such as practice hours required. This is the yes or no, whether or not practice hours are required or not for the credential. Their number, referring just to the actual number of hours required, and then their description. So sometimes there are specific places where that practice needs to be done. That is also included. So not only do we have numerical and binary variables in here, but we also have string variables. So for instance, the state SOP just means if that exists, not the one I meant to pick. The scope of practice is what I wanted. This is actually the language of the scope of practice, be it the legal language from the statute or administrative code, or in the case of certification, often it is the practice domains. And just hovering over it will bring that up for you. Let's say we want scope of practice, we want practice hours, we want supervision hours. Let's do, I don't know, renewal frequency, how many months they have to go before they renew their license. Let's say we're only interested in, and this is all left clicks, real easy. You don't have to control click or anything. You only want eviction counselors. Instead of whole country, you want Michigan. And because they're eternally feuding, Michigan and Ohio. As you can see now, Ohio has a license for addiction counselors. Michigan does not. They're both in the Department of Health and Human Services Region 5, with that 5 denotes. We have each of their scopes of practice here, the hours required, supervision hours required, how often they have to go before they renew their license. And in order to have all of this summarized at once, if you just hover over this dot, it brings a pop-up of all the variables that you picked for that row. Now for the fun. We can export all of this data too. Whatever selection you wanted with however many, let's add another one just to show that it just pops up automatically. Addiction counselors and peer recovery support providers now. Let's say that's what we want to export. Simple click. And this is where things get a little silly, unfortunately. Remember, Tableau is very good, but sometimes, just sometimes, it doesn't do exactly what we want. So when you're using the comparison tool, it's going to output 2 tables, not just one. The first table, second table, is only going to have the variable names. So what you want to do is highlight the row of variable names, copy it. Then, when you open up that first table, you'll see variable names 1 through 8, just paste, and now you have a complete table of all that data that you wanted. Variable names are attached now, all the data is associated with the proper rows, and it's only what we selected. So, using visualizations, you can go through and drill through the data to grab exactly what you want, or you can just grab all of it if you want to. We wanted to make this available to anyone for their research needs. Well, let's say, because this is 2016 data, you're noticing a discrepancy. In your state, you know that one of these numbers is wrong. Well, scrolling down below the tool, either of the tools, shows the Improve Our Tool form here. With your name, email, phone number, which subject, either you're having a problem with the visualization or there's an error in the data, or other. And giving us a small message and letting us know if you want to be contacted, you can send an email directly to us telling us how we're wrong and what we can do to fix it. And because of the cloud functionality of Tableau, working with Google Sheets, we can update that automatically for you. This is what we're really hoping on. We do have time set aside each year to go through and try to renew all of our data, but we are imperfect. We may miss something. So if ever we get a release of a lot of data at once, so say a nursing organization releases all of the scope of practice information for advanced practice registered nurses in a single year, we can upload all of that information to our own database and update it immediately. Or if there's a simple law change in one state, say in Kentucky, they're changing some of the scope of practice for their addiction counselors, if someone alerts us that happened, we can go through, look at what changed, and immediately update it. And like I said, this will create a save state, which will allow us to then track the changes over time. So we're definitely looking forward to hearing from people. And I think that's what we're going to leave it. As I said, going forward, what we intend to do is expand our database to include all of the credentials that we've collected. So that means all of the credentials for mental health counselors, not just one per state. All of the credentials for addiction counselors, not just one per state, and as well as adding CHWs, community health workers. We also have a line on getting the scope of practice for physician assistants, which would be interesting to add as well.
Okay, thank you, Cory. And once more, if you have a question and you're in the audience, feel free to ask it via the chat panel on the right of your screen. And if I may say so, Cory, I find it a very interesting tool. I believe a lot of people will find it very useful, and I'm really looking forward to seeing how it develops in the future.
Oh, believe me, I am too.
Okay, and we do have a question here. When will the updates around mental health counselors be completed?
I don't have a specific date on that. We just got our funding for the next couple of years, which means that we can now go and contract out with the people who helped us build this. I imagine since we have all of the base work already established, it shouldn't be more than another month or two. I can't firmly commit to that, but honestly, it should not take that long. And if you are interested in that data, let me share my screen again, because you can actually get to that, not as a CSV, unfortunately, but so here's our website. If you come down to projects, and again, this will be looking prettier soon, and come down to scopes of practice, you will see, where are you? Here, a descriptive analysis of state credentials for mental health counselors. This was our year 2 project. You'll have a full report available to you here, which downloads as a PDF. And in the appendix of that, aside from all the research that we did and we broke down in terms of, I'm sorry for scrolling, I know this is obnoxious, we did talk about all the data and we broke it down by category of license. You will see at the end here, these were reciprocity and endorsement laws across the country for MHCs. And this actually broke down training credentials, so credentials that were required before obtaining a full practice license. Just summary information here. Then we also broke it down by independent practice credentials, so these are the ones that allow you to practice professionally without having supervision. And then we had supervision credentials. So a lot of the data you can get at yourself right now. It won't be part of the table, but you can find that on our website. Again, if you go to projects, scroll down to the bottom of the page and find descriptive analysis of state credentials for mental health counselors and download our full report. You'll have access to a majority of our data as well as some analysis we've already done on it to make it easier just to grab quotes. And I think our brief also includes, our brief is a lot shorter. It doesn't include the appendices, but it does break down our findings to be a little bit more digestible. That might help you in the interim as we try to get that running.
Okay, Cory, we have another question. How will you select policy changes to track? For instance, are you going to note when a state might move towards independent practice for APRNs?
Okay, so we do actually have that variable tracked somewhere in a different database, and that definitely is something we are going to try to incorporate. Currently, we would only be looking at the variables that are on this database right now, and I don't believe independent practice is coded for all of them. That would be probably another week or 2 of work in order to update that for every entry. But yes, that is something we have looked at for APRN specifically, as well as for addiction counselors and mental health counselors. So it is something we can incorporate. But for the most part, the policies we're going to be tracking are going to be about credential requirements. So again, what kind of degree is required, how much practice, how much supervision, how many hours, continuing education hours. There are also specific fields for how the education needs to be spent. So in a lot of states, for instance, there are continuing education hours of having to take a certain number of hours in ethics before getting the license renewed. Or for proper education, you have to follow a certain rubric and a certain number of hours in each specific course. So we would track changes in those, definitely. We would definitely track changes in scope of practice. So if suddenly a state or an occupation in the state didn't originally have the ability to diagnose, they have now been given that ability, we would track that change, which we feel is important. We would track any changes to reciprocity or endorsement pathways, which we hypothesize increases the flows of professionals into the state because it lowers the burden of acquiring a license or a certification again after moving. But yes, so in short, everything that we have already collected, that's what we would be tracking if it changed. We have looked at whether or not the person can practice independently and whether or not they can supervise others. That is a variable we would need to get up and running because it's not available for all occupations yet, but it will be incorporated, and thank you for that question.
Cory, do you have any parting words or anything you want to say before we wrap up?
Yeah, if anyone is interested or they have their own data that they've done, we have gotten people coming to us with research that they've done on their specific segment of the workforce. AAPA came to us with physician assistants, which was really helpful. We have also seen work done by the AMA regarding prescriptive authority for PAs and APRNs, things like that. Any information about broad swaths of the behavioral health workforce that you'd like us to see incorporate, by all means, email us. If there's a contact us page at the website at behavioralhealthworkforce.org. We would love to have anything we can that we can include in this work. This was all essentially done by hand, so to have work that we can trust from other people that we can incorporate and make this a collaborative effort to get more information available in one spot would be lovely. And tell your friends. We would really like some more traffic on this tool. I worked diligently with our programmers to try and get this project as accessible as possible to as many people as possible. So if this is useful to you or you think it's useful to someone else, please let them know. We would really like to see them come visit our site.
All right, thank you, Cory. Well, I don't see any more questions, so I guess we'll go ahead and end the event right now. So once more, thank you for the demo. I found it very informative. And thank you in the audience for attending our event. We hope to see you again in the future. Have a good afternoon.